So I got sick about 7 years ago. I just started having a variety of weird symptoms, including fatigue and a lot of pain. It didn't take too many stops before I made it to the rheumatologist, but they still couldn't quite nail down what was going on. And I was in that space for probably about 4 years before they got me narrowed down to Sjogren's syndrome. And that is an autoimmune arthritis. It's systemic, so it causes a variety of symptoms, including the pain and the fatigue. I think I felt like once we reached diagnosis, then we would fix whatever it was. It really had not occurred to me that there were these conditions that just went on forever. It's pretty overwhelming finding out that you are forever sick and that you're going to be living with this and all the symptoms of it for many, many years. When we talk about why it's important to consider the end user in healthcare, patients need to be part of everything within healthcare because they are the end users. So that applies to research, it applies to design of tools, their own care, and bettering care for other people. I think that what's driving this movement is patients having been left out of the system for a long time. Patients are speaking up about not getting what they need. Patient-centered outcomes research includes involving the patients from the very beginning. They help with study design, determining what the goals of the study are. I think frequently patients have questions that they need answered that no one else is thinking of. The information then is shared broadly so that patients also have access to it. I think that one of the biggest roadblocks to involving patients as partners in medical research is communication. I hear from patients regularly who want to be more involved and don't know how to get involved. And I hear from research organizations saying that they need more patients involved and where do they find them. So I think that just making that connection would advance things a lot. You know, every patient is different. Some of us will require more hand-holding, some less. Patients are not frequently experts in statistics, for example. And some of us actually are experts in, say, statistics or data collection. And so recognizing that some of us are bringing that expertise is important too. My advice to both patients who have an interest in getting involved in research and to researchers who are interested in working with patients is the same. It's just do it. It's great if you can come into it with the attitude that you're not going to be perfect at it and ready to learn from the other partners. My involvement in research has been really empowering in a situation that I found disempowering. Being able to make change within the healthcare system by being involved in patient research, it makes me feel strong and it makes me feel like I'm doing something good with a bad situation.